Dr. So.
안녕하세요.
Very nice to meet you. Can you please introduce yourself to our viewers?
네,
Hello, I'm So, a plastic surgeon at Soonplus Plastic Surgery.
Dr. So, today we'll be talking about nose surgery, so rhinoplasty. First question is, what kind of rhinoplasty is popular here in Korea?
Most Koreans have a low nasal bridge, so silicone or their cartilage is used to raise the bridge of the nose. For this, we use the term augmentation. That's one of the common surgeries that's performed. Then there are those who got their surgery a long time ago, and they want their nose to be redone because the shape of their nose changes with age.
So what is the difference between rhinoplasty for Asian people and for Western people, for example?
Let me reiterate. A large number of Asians have a low nose bridge, so rhinoplasty is performed using either implants or cartilage to raise their nose bridge or tip. On the other hand, Westerners generally have a prominent nose, so those that benefit from their rhinoplasty are those who have hooked or crooked noses, have breathing problems, or if their nose tip has a shape that is bulbous or slightly bulbous. As a result, many of them want to sharpen their blunt nose. And as many of these Westerners have an arrow nose, most of the plastic surgery that they do there are focused on straightening the nose or fixing the shape of the nose. Korean patients used to come and see me and ask me, while holding a picture of a celebrity, if it was possible to look like them. And that's how they used to consult with me. But these days, it's not just celebrities, as social media and YouTube have become big influences. Patients nowadays bring pictures of influencers and YouTubers for their consultations. So instead of going with trends, I think people nowadays have wider choices. They also want a nose with its own uniqueness. So it has definitely, absolutely changed.
So some people prefer nose fillers over nose surgery, but as a doctor, do you mostly recommend nose fillers or surgery?
Fillers are also very good. For example, those who don't want a rhinoplasty but have a slightly uneven or low nose bridge, or have a dent right in the middle of their forehead, fillers would do the job just fine. I recommend it for people like that. But I don't recommend fillers to raise the entire nose bridge or even just the tips. And I don't recommend that patients continuously get fillers to keep their shape, because if you use fillers, in the long term, it could get in the way during a surgery. In conclusion, I recommend just using fillers on small areas around the nose, between the eyes, and or other small areas to make minor improvements. On the other hand, I do not recommend fillers for long-term augmentation.
So for this surgery, what kind of material is used for nose augmentation?
Silicone is the most common used material for implants, and it is also one of the most widely used. Other materials out there include Gore-Tex, and a combination of Gore-Tex and silicone called Gore-Silly. But back to the point, silicone is the most commonly used one. There are many other implants out there, and choosing the right implants for your nose is something you have to decide after consulting with a doctor.
What makes Soonplus Plastic Surgery or nose surgery in Soonplus Hospital different than other places?
I have been working as a full-fledged plastic surgeon for about 20 years. The nose has been my specialty for 15 years, so I'm very experienced. In terms of cases, I've had experience with so many, so when I'm consulting or doing operations, I don't stick to one method or one material. I use the methods and materials appropriate for the case. I explain that to patients, and I put it into action as well. We have a CT scan machine right here inside the hospital, so more accurate diagnoses and plans are available for you. Sometimes, basing it on the CT, we can make implants that are more tailored for the patient.
Okay, thank you, Dr. So. This was my questions for nose surgery.
Once again, I'm Sa Insa, a plastic surgeon from Sun Plastic Surgery.